Telehealth, the use of technology to deliver healthcare services remotely, has transformed the landscape of patient-doctor interactions. It's not just a trend, it's a paradigm shift that's here to stay. In this discussion, we'll dive into the many facets of telehealth, exploring its benefits, challenges, and the profound impact it has on healthcare access for people of all ages. Telehealth has indeed gained popularity during and beyond the pandemic, and it offered several advantages that make it particularly useful for seniors. Well, a lot of seniors are not aware of the advantages of using telehealth. I came up with 10 advantages of telehealth, and I'm going to give examples of each, okay? Let's start with convenience, of course. Everybody wants convenience. Telehealth allows patients to receive medical care from the comfort of their homes, saving them time and travel expenses. For example, a senior with mobility issues can consult with their doctor without leaving their home. How about that? The next, accessibility. Telehealth breaks down geographical barriers in ensuring access to healthcare for individuals in remote or underserved areas. A patient in a rural community can receive specialist care from a distant city. So, timely consultations. Telehealth often offers shorter waiting time for appointments, ensuring that patients can receive timely medical advice. For instance, a working parent can quickly consult a pediatrician about her child or his child's illness by using telehealth. Chronic care management. Patients with chronic conditions benefit from continuous remote monitoring through telehealth. Yeah, for example, a diabetic patient can use a connective device to track blood sugar levels with data shared with their health care provider for ongoing management care. Reduce exposure. Telehealth minimizes the risk of exposure to contagious diseases. During the pandemic, patients can receive medical advice without visiting crowded healthcare facilities. And of course, cost savings. Why? Patients can save on transportation, parking, and child care costs associated with in-person visits. Well, a commuter can avoid travel expenses for routine follow-ups and appointments. Because you know, some people, it's just like they want to see the doctor face-to-face, wherein if you do a telehealth, it's face-to-face. Care coordination. Telehealth facilitates care coordination among multiple specialists, and of course, seniors may not be aware of that. Yeah, for instance, a patient with heart disease can have a virtual meeting with both their cardiologist and primary physician to discuss treatment plans and options. Family involvement. Telehealth allows family members or caregivers to participate in medical appointments remotely. A patient's adult child can join a virtual consultation to provide support and gather information for their parent. Let's go to mental health support. Telehealth extends to mental health services, ensuring access to therapy, counseling, and psychiatric consultations. A patient experiencing variety of depression can seek therapy through video calls, which is the telehealth. So health education. Patients can receive education and disease management guidance through telehealth. For example, a patient with asthma can have a virtual session with an educator to learn about inhaler techniques and asthma triggers. Well, as we conclude our exploration of telehealth, one thing becomes abundantly clear. This innovative approach to healthcare has the potential to change lives. It transcends geographical boundaries, improves access to medical expertise, and empowers individuals to take control of their health. With the continued advancement of technology and the commitment of healthcare providers, telehealth is poised to be an integral part of healthcare journey. Well, ensuring that quality care is just a click away. The importance of technology to seniors in the world where technology advances at an unprecedented pace. One generation refuses to be left behind. Well, of course, that's the seniors. Join us on the journey where wisdom meets innovation, where silver hair embraces Silicon Valley. Well, I made a video on the profound importance of technology to our seniors and the endless possibilities that arise when experience merges with the digital age. Please watch this.
In today's digital age, technology has the power to transform the lives of seniors. Technology enables seniors to stay connected with their loved ones, no matter the distance. Video calls bring families closer and bridge the generation gap. With technology, seniors have access to a world of information at their fingertips. They can explore new interests, learn new skills, and stay informed about the world around them. Technology can make daily tasks easier for seniors, from voice-controlled assistants to smart home devices. It promotes independence and enhances the quality of life. Don't let technology pass you by. Embrace the digital world and unlock a world of possibilities. Start your journey today and stay happy.
Now let's go to our Medicare Q&A. And these are questions asked to me by my clients. So the first question is, what are the costs associated with telehealth and do they vary by provider or service? The costs associated with telehealth services can indeed vary by provider, service, and insurance coverage. Well, here are some of the examples, potential costs related to telehealth, along with the variations. Well, insurance coverage. Well, for example, if you have a traditional Medicare, many telehealth services are covered. However, you may still be responsible for co-payments or co-insurance. Well, for instance, a telehealth visit with your primary care physician might require a co-payment of $20. Next, we go to private insurance plans. Private insurance plans often have different telehealth coverage policies. For some plans, preventive care services via telehealth might be fully covered, while specialist consultations may involve co-payments. Costs may vary from plan to plan. Next, we go to telehealth provider fees. Well, for example, certain telehealth providers may charge a fee for their services, especially if you do not have insurance or if you're seeking services outside of your insurance network. Well, fees may be as much as $50 up to $200. And for example, take note, it has to be in network, okay? So out of network costs, so for example, if you choose a telehealth provider who is not in network with your insurance, you might face a higher out-of-pocket cost. For instance, an out-of-network specialist consultation could result in higher co-insurance, potentially more than what you expect, the cost that you expected. So, and then we go to subscription models. Well, for example, some telehealth platforms offer subscription-based models. Well, for instance, a telehealth app might charge $30 per month for unlimited access to their services. This can be cost-effective if you plan to use telehealth frequently. Specialist services. Well, for example, mental health, telehealth services such as counseling or therapy sessions may have specific price structures. A session with a licensed therapist might cost $100 to $200, with potential variations based on providers' expertise. Of course, you have to know about the cost. And then technology costs. Well, for example, while not directly related to telehealth care fees, you may need to invest in technology or invest in internet services to access telehealth. Well, for instance, purchasing a smartphone or a tablet for video consultations or upgrading your internet plan could incur some cost. Prescription medications. Well, for example, if your telehealth consultation results in a prescription, you'll need to consider the cost of the medication itself. Prescription costs can vary widely depending on the drug and your insurance coverage, of course. Provider policies. Well, individual healthcare providers may have different pricing policies for telehealth. Well, for instance, one primary care physician may offer free telehealth follow-up appointments for established patients, while another may charge a nominal fee. Well, geographical variations. Well, for example, telehealth costs can also vary by location. In rural areas with limited healthcare access, telehealth services may be subsidized or offered at reduced costs compared to urban areas. Well, to understand specific costs associated with telehealth service, it's recommended to inquire with your healthcare provider or telehealth platform and verify your insurance coverage to ensure clarity about any potential out-of-pocket expenses.
Welcome to Secure Your Loved Ones. We will show you how a final expense policy can provide financial security for your family. With a final expense policy, you can have peace of mind knowing that no medical exam is required, regardless of your age, illness, medical history, or incarceration. In addition, our final expense policy includes a free accident benefit rider that doubles the policy amount in case of accidental death. We understand the importance of honoring your loved ones without breaking the bank. That's why our final expense policy includes funeral negotiators who work to get you the lowest costs possible. Not only that, but you'll also enjoy a 30 to 80% discount on funeral merchandise, including a casket with a locked-in price of $2,000. Secure your family's future by choosing a final expense policy. Don't leave them burdened with huge unpredictable expenses during a difficult time. Call Maria Garcia at 310-926-4229 to learn more about how a final expense policy can provide financial security for your loved ones.
Oh, it is time to say goodbye for now. Before I wrap up this special episode of Maria Cares, I want to take this moment to express my heartfelt gratitude. First and foremost, a big thank you to my incredible production team whose hard work and dedication made this show possible. Your efforts behind the scene truly shines through and have made a positive impact on countless seniors seeking vital information. We extend a heartfelt gratitude to Annabella Rivera for sharing their insights of CareChest's mission that embodies empathy, support, and the unwavering spirit of giving. The world is undoubtedly a better place because of individuals like Annabella who remind us that when we unite to uplift and support those facing life's greatest challenges, we are capable of extraordinary things. Well, as we wrap up this episode, one truth stands clear. The world of healthcare is undergoing a transformation, and telehealth is the leading way. It's not just a technological marvel, it's a lifeline that reaches across distances, transcending boundaries and making quality healthcare accessible to all. And lastly, thank you to my loyal viewers for joining us on this journey of senior information and care. Your trust and support mean the world to us. Well, I would like to send my love, hugs, and kisses to all my clients. And to those who are looking for a reliable agent, I'm looking forward to becoming a part of your Medicare journey. Well, this is Maria Garcia of Maria Cares saying take care of your health. That's the only one you got. Until then, take care, stay informed, and remember that together we can build a brighter future for our seniors. Let's join hands for better health.